Hello, my name's Kimberly Parker, Executive Director with Sierra Nevada Memorial Hospital Foundation. Welcome to Doc Talk, an opportunity for you to learn a little bit about our outstanding local physicians. Today I'm joined by Dr. David Campbell, oncologist at the Cancer Center over at Sierra Nevada Memorial Hospital. Welcome, Dr. Campbell.
Thank you.
Well, with Doc Talk, we're just trying to help you get to know our physicians a little bit better, and we're going to start off with something a little personal because I found out something pretty cool and interesting about Dr. Campbell. I found out you're a race car driver.
So I have a small race car. I have a Miata, and Miatas are ideal. They're fabulous. I got into racing close to 10 years ago, maybe 8 years ago. One of my colleagues, Dr. Richard Evans, who's also an oncologist, he's a radiation oncologist, introduced me to this. And so I've been going out to the track with him about maybe 5 or 6 weekends a year. And most of this time he's had a Mini Cooper and I've had a Miata, and he's in the process of getting a Miata. Miatas are ideal. They're cheap, they're low to the ground, they're light, they're easy to modify, and there's a lot of them around. There's a lot of people who know how to work on them if you get in trouble with trying to do home repairs. And out at the track there are a lot of vehicles, a lot of Miatas that we can race against. It's kind of all class racing, so you race against the same class, similar cars. So I'm not out there with Corvettes, I'm out there with Miatas, and they all have about 100 horsepower, so they're faster on the corners, slow down the straights, and they're loads of fun.
I probably shouldn't ask this. Have you won?
I'm not nearly as fast as Dr. Evans.
Well, that sounds wonderful. Well, you've been a local oncologist here for many, many years, and not everyone may know what that is. What do you do in oncology?
Yes, so as an oncologist, I am a cancer doctor. I'm a medical oncologist, which means I focus on the medical therapy of cancer. There are other oncologists. There are surgical oncologists and radiation oncologists that focus on their specialties, surgery and radiation. As a medical oncologist, my focus is largely to kind of coordinate the care of many oncology patients. So I'll pass the baton to the radiation oncologist or the surgeon and so forth, and I'll do a lot of long-term follow-ups, much more than the radiation and the surgeons will do. And so I kind of play the quarterback for many of the cancer patients. And even though maybe medical therapy is not specifically involved in their treatment, I will do the follow-ups and managing otherwise and get them to the right place.
And what do you find most rewarding about your job?
Oh, fantastic question.
Everything, right?
People sometimes think oncology is a sad field because people have cancer, right? And people sometimes die from cancer, which they do. But of course they die from a lot of different things. They die from heart disease and lung disease, and the list goes on and on. Cancer is just one cause of death, and most of my patients live. So for me to come to work, and I see people sometimes that are not curable, many are curable, but they're all great people, and it's a fantastic place to work with, all just loving staff, and the staff that I get to work with are all kind of a big family. You know, we get to know each other real well, and the patients, many of whom become my friends, I get to know them. It's more than just, you know, seeing people with a bad diagnosis. It's really getting to know them and getting to help them through the process that hopefully leads to a good outcome.
Our cancer center has always been very special. They've always had this belief system. We're there to treat the whole person, not just the disease, and it is a wonderful, warm environment that I've had an opportunity to be involved in a lot. Really exciting news. Thanks in large part to our community, we're opening a new infusion center in 2018. Dr. Campbell, a lot of people may not know what an infusion center is, so could you share a little bit about that?
Many of the treatments we prescribe for cancer involve medications that are infused intravenously into a person. And although there's a shift to prescribe many medicines that are orally taken and not intravenously taken, that largely we still use a lot of intravenous medications, and the infusion center is a place where people will go to get these intravenous medications. Dignity Health is in the process of building and completing an infusion center here at Sierra Nevada Memorial Hospital. It'll be a beautiful place. It's fantastic. They're going to have it's cosmetically going to be fantastic, and a place where people can come and meet other people in the similar circumstances and develop a fellowship with their with fellow patients as well as the nurses, all in the same room, and yet in an aesthetically pleasing setting. And I think that will be available within a year at least, and hopefully sooner. But it's different than the office where they come in to see me. Here they come in, they get their medication through their veins or through another access point like a portacath, and they get to fellowship with other people.
In an infusion center, they're often sitting there for quite a long time. Right now they're in a little bit of a tight space, so I think you said it right, that one of the great advantages to them is they're going to be in a much larger space. Are there other things that you see as advantage? I think I've heard that pharmacy is going to be up there closer to them.
Pharmacy will be closer, and with the help of Dignity Health, we are going to be able to provide things that we never used to have before because of cost. Things like cold caps, for example, is up and coming. Cold caps, which we've never been able to provide here because of cost, has now been supplied, or at least I think will be supplied, in part by Dignity Health. And this is a way of allowing people to get treatment that causes hair loss, but the caps fit over the scalp and keep the skin cold enough that the medications, chemotherapy mostly, can't really get into the scalp and cause damage to the hair follicles. And so the hair will remain and reduce the chances of at least complete hair loss, if not most of it.
You know, and actually, I think that's correct, but we also had a donation for the cooling caps that's coming from an event that was done by Fast and Fit. So we're very fortunate on that. I want to thank you, Dr. Campbell, for joining us in a couple minutes so that our local people can get to know our local physicians a little bit better. Thank you so much for joining us with Doc Talk, and until next time. If you'd like more information on how to give to the foundation or about our cancer center, you can either call 477-9700 or go to our website at supportsierranevada.org. Thanks so much. Until next time.
Thank you.